the specific stroke trial, I think, is one of the, let's say, next milestones in stroke treatment. We explored the safety of the add-on treatment with factor 11 on, let's say, usual evidence-based stroke treatment after non-cardioembolic stroke. So you have to consider that 75% of all patients have non-cardioembolic stroke, and we have still a 6% of recurrence rate, which is for us unacceptable. So antiplatelets are not working well enough. So our idea was to add an anticoagulation drug, factor 11, which is safe. You know, the profile, the safety profile of factor 11 is very high. And we know that, for example, in a Jewish population, when there is a factor 11 deficiency, there's a lower risk of having cardiovascular event and also a low bleeding risk. So this was the rationale to say, we have this factor 11 molecule, use it as an add-on to antiplatelets in the acute phase within 48 hours of stroke onset. It was a phase 2. So what we saw with the different dosages, we have 10, 20, and 50 milligram of Asundexian compared to placebo. On top of, as I said, on aspirin or even a double antiplatelet treatment. What we could observe was that it was safe, which was really a good result because the trial was designed for this. We could not really demonstrate efficacy because this was a phase 2 trial. But what we saw is that in patients with TIA and atherosclerotic stroke, there is a trend of the reduction in event for Asundexian 50 milligram. So just to reiterate, the safety profile was demonstrated. The efficacy profile, which was the reduction of ischemic event and covered infarct, was not reached, but the trial was not designed for this. We are now working on the oceanic, which is, you see from Pacific, we are very ambitious people going to oceanic. And we are working, and hopefully for the end of the year, or beginning in the next year, we will start with the treatment of the randomization of the patient. I think this is, this Pacific program includes also Pacific AF, which means patients who are not stroke patients, who are cardiobolic, who are patients with atrial fibrillation. The other study will compare Asundexian versus apixaban. And then we have this other branch, which is a stroke trial. So it will really be a 360 degree study of our stroke patients or at stroke risk patients. At the meeting, we had a nice discussion because, we as stroke physician always want to do more. The last 10 years were very, very exciting. So when I started neurology, as a vascular neurology, it was a very bad time because all trials were negative. We were working on neuroprotective drug, and every conference was like, really, we were sitting there, another negative trial. So now we have options which seem to really going in the right direction, and to have a safe drug, especially in our, for example, our greatest fear is that our patients bleed after ischemic stroke because we treat them with thrombolysis, we treat them with thrombectomy, so the bleeding risk is quite high. So to have another molecule as an add-on, which is safe, clearly makes a difference for us.